Now we will move on to our next speaker, Andrzej Grzybowski, who will discuss pharmacological interventions in our time. And Professor Grzybowski is working in the Department of Ophthalmology at the University of Warmia and Mazuri in Austin, Poland, and also he is a member of the European Academy of Ophthalmology. The floor is yours.
Dear colleagues, it is my great pleasure to present a talk on pharmacological interventions in myopia control in 2021. And here are my financial disclosures. None of them is relevant to this topic of this presentation. So also there were some other than atropine substances studied for this purpose in the past, like pirenzepine or 7-methylxanthine, pirenzepine M1 selective antagonist and 7-methylxanthine non-selective adenosine antagonist. And here we see many publications supporting the evidence about the effectiveness. However, they are not in use. And the only substance which is in use, as a matter of fact, is atropine. And this will be the subject of my presentation. Atropine is a non-selective muscarinic acetylcholine antagonist. It inhibits myopia development in both humans and animal models. And in humans, atropine causes cycloplegia. However, the mechanism whereby it slows myopia progression is not via paralyzing accommodation, what was proved on an animal model. And as we can see from the lower part of this slide, it provides the reduction in progression of myopia depending on the concentration and depending on the different studies from nearly 30% for the lowest concentration to nearly 67% for the 0.05% regarding spherical equivalent, and from 12% with the lowest concentration and to over 50% with the concentration 0.05% for axial elongation. And higher concentration, obviously, they can bring even more myopia control with the highest 1% atropine, nearly 80% myopia control. The use of atropine is not a new issue in ophthalmology. Here is a list of many studies starting from more or less middle of the 19th century. We were able to find the earliest study dated back to 1868 by Dobrowolski from St. Petersburg. However, the modern interest in atropine started with the ATOM-1 study from Singapore, which was published in Ophthalmology Journal 2006. And this study, which was a parallel group, placebo-controlled, randomized, double-masked study, shown that 1% atropine was effective in myopia control after 2 years of use. And however, the side effects of 1% atropine are well known, including photophobia and problems with accommodation. Then the same group from Singapore conducted ATOM-2 study, which was published in 2011, in which they compared low concentration atropine and those 0.5%, 0.1%, and 0.01%. And they shown this study that all of this concentration was still effective when compared to placebo, both in spherical equivalent and axial length. The same group also reported the effectiveness after 5 years of use of atropine, and they shown that atropine 0.01% slowed myopia progression by 50%. And this is well known that the low concentration atropine is much better tolerated than the higher concentration atropine, and it influences accommodation much less, and this also provides much less effect on pupil size. Recently, LAMP1 and LAMP2 studies from Hong Kong presented very interesting data on the use of 0.05% atropine, and they shown that the efficacy of this atropine was double that observed with 0.01% atropine in spherical equivalent progression over 2 years, which is shown at this graph here. The blue line is the atropine 0.05% compared to other concentration. This is the spherical equivalent effect, and and this graph presents the change in axial length. And again, the blue line is atropine 0.05% comparing to other concentrations. Very interesting study was recently presented and published in Ophthalmology journal. As a matter of fact, very recent, it was published just in the middle of October, so a few weeks ago. And this study compared 8 atropine concentration for myopia control in children, and they shown that the ranking probability for efficacy was not proportional to dose, particularly for the concentration of 0.05% atropine that was comparable to that of high dose, like 1% or 0.5%. However, for pupil size and accommodation amplitude, this different concentration, their effectiveness were dose related. Here we see the data from this study, and particularly this is comparison between different concentration of atropine, and when we see the atropine 0.05%, we clearly see that it is that the effectiveness of spherical equivalent control or influence on spherical equivalent is even higher than 0.01% or 0.25%, and it is closer to the higher concentration of 0.5% than the other concentrations. And the next graph presents the same phenomenon regarding annual axial length change, and the same is presented here regarding the concentration of 0.05%, which is shown here, and the results are closer to 0.5% than lower concentrations. So, in conclusion, I would like to summarize that with the meta-analysis, which was published a few years ago in Ophthalmology Journal 2016, and at that time, the authors of this meta-analysis compared 16 interventions for myopia control in children, and at that time they found that the atropine was the only intervention providing the highest effectiveness, as you see, clear effects in myopia control by high dose atropine, moderate dose atropine, and low dose atropine. The moderate effects at that time was shown by pirenzepine, as I mentioned, the substance which is not in commercial use, orthokeratology, and peripheral defocus modifying contact lenses, so optical approaches. And the recent review by Cochrane database of systemic reviews from last year supported this evidence, saying that anti-muscarinic topical medication is effective in slowing myopia progression in children. There are much more studies ongoing on low-dose atropine, as you see here from clinical trials database. There are over 20 studies based on low-dose atropine ongoing, and 6 studies based on combined treatment. So we hope to see more data to be included in our practical work soon. And at the end, I would like to welcome everybody to join our European Network for Myopia Control, the group of ophthalmologists who share the experience and knowledge about the treatment of myopia. Everybody interested to join, please contact me by email. Thank you very much for your kind attention.
Thank you very much, Andrzej, for your excellent presentation of this, which is the atropine use is in the center in many practice and very important management possibility of myopia progression, to prevent myopia progression. So thank you very much again.